Hi there, this is Leonard Kish. I'm here on Health IT TV. We're doing a segment on decentralizing healthcare. And I'm here with Zayna Khayat, PhD. You're a senior advisor to MaRS in Toronto, and you've got a number of pretty cool jobs. So tell us about MaRS and tell us about innovation that's happening in Toronto around health IT and decentralization.
Yeah, sure. So MaRS stands for Medical and Related Sciences. So the idea was about 15 years ago, the founders saw that the future of health was going to be convergence, so hence the related, that could we take the assets on the biomedical side that are kind of built in their cones of expertise in therapeutics and devices, et cetera, and converge them with the next layer of sciences, the arts, et cetera, and create a convergence hub for that. And that's what the MaRS center is. It's a physical place. So our language is it's an innovation hub. So in that hub, there's a physical place of about 1.5 million square feet, where it converges, the science, the arts, the VC, the startups, the big corporates, clinicians, all in one big building, about 6,000 people at full capacity, kind of just doing innovation stuff, mixing together. And then that's like the hardware, and then we run quite a few different programs to actually kind of get Canada into the new health economy. And I lead a lot of those that are on the adoption side of innovation, which is debottlenecking or unclogging our fairly fossilized systems of health that are not quite receptive to new tech. And then that's in tandem with the other side of MaRS, which is on the supply side of innovation, which is ventures. So we have about 1,300 startups we support in the MaRS Center, and about 300 of them are in health. And so my job is to connect them to markets and systems and get adopted at scale. And then we have an entire team that helps actually make great startups. So that's kind of the big picture.
Wow. 1,300, that seems enormous. It seems like just about any large metropolitan area would be proud to have that many.
Yeah, it's a pretty big deal. They're not all physically in the building. It's a virtual model, but that's across health, fintech, clean tech, ed tech, retail tech. It's all tech, but health is a big part of it.
How did this all get started? It's been around for more than 10 years now, right?
Yeah, so about 2000, the building that MaRS is in, and you could pan to it if you have the ability, but it's at a pretty interesting corner of Toronto. The closest comparator would be like the Cambridge region of Boston. Okay. High density of academic health science centers. So about $2 billion a year of biomedical research in this kind of square block area, and right at that corner, so 9 academic health science centers. Kitty Corner is University of Toronto, I think North America's third largest university. 70% of their output from an IP is biomedical, so big medical infrastructure. And then Kitty Corner the other way is Ontario's Ministry of Health, which is a $50 billion single payer, I think the largest HMO in North America. So you've got the payer, the academic infrastructure, massive delivery capacity, all in a very, very dense urban, right downtown. So our financial district, like our Wall Street, is just a few blocks up the road. So an urban innovation center. And basically the building we're in was a decommissioned old hospital, and these philanthropists said, we need a vision and a global address for Canada in the new health economy. So they bought the land and developed the project, but we own the building, and that's kind of our business model as well, to allow us to do mission work.
Okay, that's cool. So it's a giant centralization in a way of all these bringing all these actors together in a way to get them to work together.
Yeah.
And so much of the innovation is about, with the whole digital health revolution, is about pushing decision making and technologies to kind of network endpoints where individuals can kind of make their own best decisions. What kind of innovation are you seeing along those lines? And the 300 companies, are these digital health companies? Are they devices?
Yep. So about 30 are in therapeutics. So that's not really the decentralization. That's kind of, to me, more personalized medicine and pushing those frontiers of science. About 90 are in medical devices, from class 1 to class 4. I'd say about half are enabling things that used to be done in centralized institutions to be done at home. And I'll talk about one of them in a second. And then about 200 are in the digital health space. And I'd say all of them are pushing the biggest shifts in medicine, right? Proactive care or preventative care instead of sick care, decentralization, as you talked about, people-powered healthcare, so full disintermediation of formal medicine, almost completely, not centralizing it. Continuous care instead of episodic and intermittent, and then value-based healthcare. So we do quite a bit in outcomes financing. So decentralization is one of our 5 big lenses of how we work with startups.
Oh, wow. So, and you mentioned that you were doing a blockchain summit sometime soon, right? Or a blockchain event.
Training events. We have a 2-day training workshop to get certified to be able to, build the blockchain, develop, I don't know what the word is.
Develop on it.
What coding boot camp, that version. So that's running out of MaRS actually Monday and Tuesday of next week.
And it's not just fintech then. This is
nope. This would be anybody. Yeah, but that's the beauty, I think, of the convergence, right? So, we have some applications from a health startup that our health system's just not ready for. Face recognition to do authentication, right, as an example. Well, their first client, even though they came through health, is our banks that are using that in their bank machines to authenticate when you go to, take out money or whatever. So the base technology is kind of the same, right? And that's the beauty of the platform.
And a lot of this innovation is, you see with patients now is coming from, people with real problems, and it seems like it's enabled kind of by the maker movement. It's this idea that, software and hardware are becoming so inexpensive that almost anybody can kind of innovate around that. Yeah. Are you seeing the same kinds of things with the innovation that's happening there in Toronto?
So for sure, the maker movement, maker spaces, that all is, front and center because it's a pretty tech-heavy town. I'd say in healthcare, we're quite behind. We're probably a generation behind in terms of real citizen activism and ownership and empowerment. Like, we don't have an e-patient Dave for Canada. We don't have a Stephen Keating. We don't have an Oscar or Hugo. But
you really have probably a lot less pissed off people.
We're pretty comfortable with our generally mediocre healthcare, so we don't have that. But and it's accessible to everybody, right? Healthcare. So you're right. There's not as much of a gap. But I would say, if I look at the portfolio, it definitely is enabling what you're describing. What I call people-powered healthcare. So that is, decentralization, like I said, disintermediation, and basically self-management. But it still has an intermediating party called the startup versus all patient-led.
What brought you to the decentralization as a lens? What are the other lenses, and do they kind of fit together? And what brought you to that?
I'll show you the figure. We kind of have our 5 big shifts. That's kind of our framework. I can get it to you, but it's just such a massive driver, right? In general, so it's a bit of what's going on in the market, but more of every other industry did this. It's a kind of natural next thing, right? So, and then it's a top policy priority of, for sure, our province, so our $50 billion single payer. That's one of their top 5, which is better health closer to home. So just stripping out of these kind of capital and labor-intensive centers.
Right.
And then it's now a federal policy for the whole country of Canada, home care. So it's kind of the direction everything's going.
So real understanding that, the bricks and mortar is the most expensive way to deliver care, I guess, then, right?
And inconvenient, not patient-centered. I mean, it's all of that.
Right. Yeah. You had mentioned you were going to give a TED-style talk to your new Prime Minister.
Yeah, that was on Wednesday of this week.
Yeah, so what was that about?
Yeah, that's when we were supposed to talk.
Yeah.
So really interesting. So as you know, every economy in the world is, now in this global innovation race, and is trying to win in innovation, right? So the the knowledge economy and converting those assets. And so we've had a bit of not a strong point of view on that for the whole country of Canada as a federal policy. So imagine in your world, each state, Denver wants to win in innovation and California wants to win, and that's great.
Yeah.
But from a whole policy, so our new government has decided we're going to be an innovation nation, and language like that has never come out of federal. We're quite decentralized in Canada in our governance. So, and launching of all that was that day. And so they invited kind of 4 big thinkers, if you will, to kind of share their point of view to get a lot of excitement about the launch. And so Actually, I didn't even talk about healthcare in my talk. I talked about how vital government innovation will be to actually win in the new economy, because systems of health, energy, education are so intertwined with government. So you can't just have startups. You need the other side to innovate. So that was my thesis. And then we had the CEO of Shopify. I don't know if you know that startup.
Mhm.
Kind of one of our only unicorns in Canada in retail. CEO of GE, and the CEO of Taxi, which is a big kind of marketing firm. Anyway, so it was good, big excitement, and we're happy to have our federal government interested in innovation.
Yeah. Do you feel like it's a lot different in Canada, or what are the big differences? It seems like it might be harder to raise money in Canada.
We're severely undercapitalized on a per capita basis in health,
In health.
no question. But I don't know that it's any worse, I'll be honest, from Seattle or Denver or Miami, right? There's
Right.
two big locuses in the U.S., in the
Yeah.
world for
Yeah.
health VC, and then the rest of us, I think, really struggle.
Yeah. Well, you had mentioned a few companies that you wanted to highlight.
Yeah, so one that, so again, we work on the invention side, which is ventures, and then adoption, which is what I do at MaRS. And so one of the programs in my adoption work, it's called Excite. It's a long acronym, but basically we find a highly disruptive technology that in our portfolio, introduce it to the Ontario health system like 2 or 3 years before it's ready for market. And if it looks promising, we help work with the payer to build the evidence they need to prove that there's a business case to reimburse and to adopt. And so the first one that we've put through that process is a home sleep apnea diagnostic. Very simple, no wires, no technician, gets the data and can give you your apnea score. And for us, that will fully disintermediate labs, sleep labs, which is high capital, high resource, bricks and mortar, in a physical infrastructure. So that's the first to go through this process, right? And if the company tried to do that themselves, they would have never ever launched in the Canadian market, because they can't, disintermediate an entire system that was designed to never change.
Right.
Right? So
Right.
we handhold literally the payer through a adoption process and bust down all the path in the forest for this, exactly example of decentralization, right?
Right.
Um,
I think there's a lesson to be learned there, right? That the providers have it pretty good, and cost savings are always going to be difficult if you start with a provider.
yeah,
It really does, take starting with the money and the flow of money.
absolutely. And so on this program specifically, 11 big payers in the U.S., including CMS, the FDA, and then a couple big European countries got wind that we've developed this way to actually, connect the buyer to the supplier in a proactive pull model of innovation instead of what we have today, which is selling,
Right.
which is kind of nuts. If public resources are funding research and innovation, like, shouldn't they also therefore buy at the end of that process? So we've connected that loop. So now we're replicating this model in the US and the UK as we speak.
Oh, really? Where?
So in the US, we're working through CMTP. I don't know if you know them in Baltimore, but that gets CMS at the table, Blue Cross Blue Shield, Kaiser, Mayo, and a bunch of others in the FDA. So great model, to have 3 jurisdictions at the same time agree on a coordinated kind of pull model. Not for every tech innovation, but for these ones that are so disruptive that you need a facilitated process. You can't just do sales to get them in the system. It's not going to work.
Right. Fantastic. Yeah. Just about any urban center would love to have that kind of innovation going on. I know that Denver is working towards that. It's definitely not, it's healthcare is kind of in its segment, and clean tech and is in its. But it's great to see all that come together.
Yeah, it's the future. It's what it has to be if you're going to actually solve the nutty problems that are left to get solved.
There's a few left, I think.
Yeah.
All right. Well, thanks, Zayna. It's been a pleasure talking with you, and happy to have you on Health IT TV talking about MaRS and innovation, and look forward to chatting with you again sometime soon. Thanks.
Thanks, Leonard. Take care.
All right. Take care.